Okay, we're back to talk a little bit more about deep tissue massage in the area of the calf. This is to treat plantar fasciitis and primarily Achilles tendonitis and other tendinitises that can happen, such as peroneal tendonitis and posterior tibial tendonitis. The tools that I find are the most effective. If you want to get the greatest version of deep tissue massage tools, it's to use the triggerable, the TP therapy tools. They come with hard balls like this that have a little covering over the top. It has a roller that if you see it, it's a little bit concave here, or convex right here. This is to penetrate deeper in, and it comes with a traditional yoga block. So I'm going to go over how to do this type of a release in the back of the calf. The anatomy we want to work with is the gastroc soleus, but also deep to the gastroc soleus in the back of the calf are going to be your flexor tendons, your flexor hallucis longus, your flexor digitorum longus. And these are going to be the tendons that are running deep to the gastroc soleus complex that many times are involved with issues like plantar fasciitis, Achilles tendonitis, because things get tired, things get bound down, and they get tight, and they need to be released, and these are the best tools to release them. So we'll start. We'll put your ankle and your calf up here. We'll start with this is the step one of the therapy. So you're going to take this, and you have a little area of a dell right here in the back of your calf. You're going to put the tool right on top, and you're going to slightly roll back and forth, and that's going to have a little bit of a burn. And basically you want to be the area where it hurts the most. So you can go back and forth, and then the next step is you roll your foot in a big circle. Do that 3 or 4 times, then you go the other direction 3 or 4 times. And then we're going to lift the foot up, and on the way out you're going to breathe outward. Up and out. That's working with the gastroc soleus and some of the muscles deep. Now we're going to go to the peroneal tendons. The peroneal, you can go on the outside, and if this is painful, for some people this isn't painful at all. You have to be really careful, because if you go up too high, you're going to hit an area called the fibula, or the nerve that's up here that comes down. So just be careful not to go too high with this, and you're going to roll back and forth. If you have a peroneal tendonitis, this is going to help loosen that up. And then the same way, you're going to go one direction 3 or 4 times, the other direction 3 or 4 times, and then you're going to go up and then breathe out as you go down, like that. And then the last muscle complex we're going to work is the posterior tibial tendon. This is the one that's going to be many times painful and tight if you have plantar fasciitis. Rolling it back and forth the same way. And then once you find the area where it hurts the most, you're going to go in circles. 3 or 4 times, 3 or 4 times, and you're going to go up and then breathing out as you go out. That's step one of using the trigger point tools. Once you do that, we're going to go on to step 2, and this involves using the ball. There's a 1-ball or 2-ball technique. Basically, this ball is going to sit in the back of your calf, and it's going to push to reach the deep musculature there. Many times the tendons in the bottom of the foot, if you have like hammer toes that flex down, or if you have a problem with one of the tendons that pulls down the big toe, that can be tight. The way you find out where it hurts is you put the ball on the back of the calf, and you gently move it back and forth to find where it hurts. Once you find an area it hurts, that's called a trigger point. When you find that one area, then you hold it there, and you can roll slightly back and forth. And that tends to be quite painful. Once you find it, you can sit on the area, and that's where you move the foot in a circle. This really hurts. This modality really hurts. One direction, other direction. Then you can go up and then breathe out as you go out. So breathing is really important. The 2 aspects that are really important with these modalities are breathing and also hydration. Very similar to when you go get a massage. After you have a massage, you have to hydrate well, because your muscles are resting and relaxing and kind of getting worked out. And the next component is going to be the 2-ball technique. With the two-ball technique, you take one ball on top and one ball on the bottom. In this one, you turn your foot inward, the other way, and you sit it right up on top. You can either use the block or not. I'm using the block to make it a little bit easier to show. And you can put the two-ball technique with one hand on top, and basically you rub it back and forth. And you find any area that's really painful, and you can massage it this way. You can do it with two balls. You can also, if you want to, you can do it just with one ball. And this is if you have a trigger point in the posterior tibial tendon, you find out where it hurts. You can go all the way down here to the Achilles tendon. Doing this deep tissue massage on the actual Achilles tendon isn't very beneficial. You want to be in a muscular area in the back of the calf that can actually loosen up. So we recommend finding the area that hurts and you roll back and forth on that area. You can either do this with one ball or two ball. One other technique that I wanted to share is if you're moving it with this roller right here, and it doesn't feel like it's working that much, you can actually plank yourself up a little bit to get deeper. So we're going to show how you plank up, and that really pushes it in. Or another technique you can do, both with this or with the foam rollers, you can put the other foot on top. So you're saying, well, I don't have a doctor to hold my foot while I'm doing it, or a physical therapist. You can actually increase the body weight on top of this by putting your foot on top. And this can be done both in the back, or you can do it on the inside or on the outside for this type of a treatment. So this is how you use the trigger point tools if you're dealing with Achilles tendonitis and plantar fasciitis.